Good morning and happy Saturday. I am going to be doing all these videos mostly in the morning because that's when I first wake up and feel the most inspired to answer these frequently asked questions about therapy. One of the questions I actually just got asked yesterday is someone called, they needed to get in for trauma. So when do you start trauma? It's extremely important if you do have post-traumatic stress or trauma from your childhood or recent trauma that you just are currently trying to get over, even if it's a breakup, because trauma is relevant, right? It doesn't have to be a car accident. A lot of trauma people experience are emotional traumas. It's extremely important that you see a seasoned therapist for these reasons. One, if you start therapy with trauma work, and you aren't helping the client or you stabilize first, you can actually get more traumatized by the therapeutic process of opening up more trauma. So therapy is kind of like an art where you kind of know when to start a person, how to push them just a little bit, but at the same time, not start them where it can make them or decompensate. So you've got to be able to have your therapist guide you through that. And so again, that you're not starting the trauma work right away. It can take, sometimes I've had people that were so fragile and destabilized, it would take 6-7 months before they're ready. Other people, they can start the 3rd or 4th session. So it's just super important that the therapist knows how slowly or how fast to go there and how much. The other thing is, it shouldn't be all your trauma all at once, right? So what happens is your brain can only process a certain amount. And if you overwhelm your brain and you think about surgery, right? You want to go in for surgery, but you don't want to get everything done all at once. It could be overwhelming and the recovery process could be hard. So you want to make sure that the therapist that you're working with is very gradual and sees how you do, and you see and give feedback about how you do between therapy sessions. So if you're decompensating, like you're having rage problems, you're depressed, you're getting more anxious, you're not feeling like you want to see anyone, you start having job difficulties, all of those are signs that the trauma work is going too fast. It's not, in other words, it's not a good sign if you are feeling worse after therapy between sessions. Now, that doesn't mean for a day or two you might not feel a little bit off, but you shouldn't be getting flashbacks and rage attacks and anxious moments from therapy, right? So it's super important that you give your therapist that feedback and that the therapist knows how to go slowly. The other thing, and I had mentioned surgery, is a lot of people come and they want to talk about a trauma. They want to do trauma work. And as I talk to them more, they're actually not having any symptoms from that trauma. And the trauma actually doesn't even bother them. They just figure while they're in therapy, they should talk about this. So this has happened so many times. So it's extremely important, just like a surgeon wouldn't go in to heal something that has already been healed, that you can acknowledge that some of those wounds have been healed, or and you're healed from that wound. So we're not going to go back in and do trauma work for something that's already healed, especially if you're not having symptoms. And symptoms, I mean, again, depression, anxiety, relationship difficulties, mindsets that are negative, that are specifically related to that trauma, right? So you've got to be really specific about which trauma is causing what. That's the other thing. So those are some thoughts for you regarding trauma work. It's a lot more complicated than just let's go do trauma work. The other question is, do you feel that you know what your therapist's methods are for trauma work? So there's a lot of different types of trauma work, and the method I use called feeling reduction work and inner child work and mindset shifts are extremely user-friendly. You can use them during the week, but at the same time, I truly believe as a therapist that we don't have to live with trauma and PTSD for the rest of our lives. I believe that you can overcome trauma and that therapy shouldn't only be focused on healing trauma and diagnoses. It should also be on your strengths and what you want to do and what vision you have in your life. Another thought about trauma work, which I am boldly going to say, is there have been a number of people, I've been a therapist now for 20 years, that have come to me after they've been in therapy, and the therapist has told them that they think something had happened to them, like they had been molested or they had been abused, and they have no memory of it. And they were about 7 or 8, and now they're upset with that parent. Okay, so here's the deal. Most of the memories that you've experienced that are that traumatic over the age of 5, you will remember. There is very little research that proves that you're going to forget a memory that is that traumatic for you. So if you're under the age of 5, that is a possibility because your prefrontal cortex is not yet developed. So most of us don't remember things that have happened under 5. And I would still be cautious about that because you probably are dealing with enough that you don't need to regurgitate memories that you can't even remember. So that's the other thing about picking a therapist, is you want to pick someone that has gone through their own healing process. And I would ask the therapist if they believe in hidden memories, because I know that's a very popular thing to talk about, and you see it on like Dr. Phil shows and all this kind of stuff. But the science behind that is very, very minimal. There are very few people that actually block out memories. If something that traumatic happened to you, you would normally remember it. Given said that, if there is something that's very traumatic that has happened to you, again, you want to start with the smaller traumas first and then gradually go up. And the therapist needs to decide whether or not you need some functional adult skills around mind shifts. For example, if you were neglected, or your dad left, or your mom left, or you had experienced sexual abuse or physical abuse, and then you made up your mind after that I can't trust men, I can't trust women, I will, gain all this weight so people won't touch me to protect myself, or the other way, have anorexia, or you have a lot of defense mechanisms, right? Then that would mean that you are having symptoms of those traumas, and that you absolutely need someone that's skilled, that is going to go in that mindset trauma slowly. So it might not even be chair work where you're confronting the perpetrator, which you wouldn't do. It would be that your mind shifts, the things that you've decided and inner vows that you've taken are now affecting every relationship. And now you're taking that out on your body, right? So again, the trauma work is very complex. There's complex trauma, there's simple trauma, and there's trauma that, one more point, there's trauma, for example, if you grew up in a family, your brother or sister might have experienced something that was very traumatic for them, and you experienced the exact same thing, but for you, the trauma didn't affect you, right? So we don't want to assume as therapists that every person that comes into our chair that's had a traumatic experience may be affected by that trauma as much as, say, their siblings. So you being teased in school might be more traumatic for you than your parents' divorce, or, vice versa. So it's extremely important that there's not this all or nothing, or this label, because that's why I said seasoned therapists, because when you're in school, you learn how to treat things from a diagnosis treatment perspective. But as you get more seasoned, you really know how to use your skills and your past experiences. And then, of course, for me, I've overcome so much overcome all my trauma and addictions, that I can really go in there and assess what to do. It's really, really like an art. So anyhow, I really want to encourage you, if you're doing trauma work or if you're starting trauma work, you are going to overcome this. You are an overcomer. You do not have to have an identity in your trauma, and nor do you have to be defined by it or live by it. So remember, we have the lion mentality, not the sheep mentality. So I always like to say that, lion versus sheep. You've got to go in this strong, but at the same time, let your therapist be your coach, your mentor, and overcome.